Congratulations on completing your orthodontic treatment. Even though you have been debonded, you either have finishing aligners or retainers. In this video, we will cover how to wear and maintain your retainers and aligners, when to come back for a retainer check, and what to do if you break or lose your retainers or aligners. If you are completed with treatment and have only received retainers after deband, you will need to schedule a 6-month follow-up with our office. If you are given finishing aligners, you will have to schedule an aligner check and a 6-month retainer check. When you are completed with treatment, it is a good idea to schedule a cleaning with your dentist. To clean your aligners, use a toothbrush and toothpaste. Make sure to brush and floss your teeth as well before inserting your aligners or retainers, which you can do how you normally would. You can deep clean them using Effordent, Retainer Bright, or an ultrasonic pod a couple of times a week. You just soak them in cold water with the product for 15 minutes. Aligners and retainers should not be placed in hot or boiling water as they will become deformed or melt. Retainers should be worn every night to prevent your teeth from moving or shifting. Even as an adult, your teeth can still move. So it is important that you develop the habit of wearing your retainers every night indefinitely. If your retainers are lost, broken, or no longer fit, call us immediately. Aligners need to be worn full-time, meaning 22 hours a day. You should only take your aligners out to eat, drink anything other than water, and when you are brushing your teeth. Each aligner tray should be worn for 7 days unless prescribed otherwise. If you miss days or are not wearing your aligners full-time, pick up where you left off and wear that tray for an additional 7 days. If you lose or break an aligner, send us a grin scan and message about it immediately. We will instruct you on how best to continue with your treatment. Now let's talk about how to properly remove and insert your aligners and retainers. Each aligner will be labeled with the tray number. Make sure you have the correct tray. You only have 2 retainers, one for the top and one for the bottom. To remove, go from the tongue side of your teeth and pop off the back molars on each side. Then gently lift off your front teeth. When inserting, line the tray up with your front teeth first and push down. Seat the rest of the tray by sliding towards the back and pushing the tray onto your molars. While inserted, the aligner or retainer needs to be seated all the way down, meaning no gaps between the tray and your teeth. Try using a chewy to seat the tray all the way. When you are not wearing your aligners or retainers, you should be storing them in a case which we will provide to you. Our motto is from mouth to case, from case to mouth. An aligner or retainer should never be stored in a paper towel, napkin, or pocket that will be sat on, lost, or thrown away. Keep them stored in a drawer or cabinet to prevent them from being eaten by pets. There are no food restrictions when it comes to clear aligners, and you can eat whatever you like as long as you remove your aligners prior to eating. Be sure to brush your teeth after every meal as to not trap food in between your teeth and the aligner when you put them back in. You can leave your aligners in if you are drinking cold or room temperature water, but must remove them for drinking anything else as it will stain, melt, or deform your aligners. Chewing gum is not allowed with aligners in because it will pull the aligners off of your teeth. Smoking is also not advised with aligners because it stains your aligners and your teeth. Even though you are done with orthodontic treatment, you can still explore our other products and services we offer, like teeth whitening, prescription strength toothpaste, and custom night and mouth guards. Thank you for watching our post-treatment instructions video. We hope these tips help you maintain your beautiful smile. If you have any questions, feel free to contact our office. Keep smiling and take care.